Hi, I'm Matt Jones, CEO of Murray PHN. I'm pleased to introduce our first Murray Health Report for 2022. Each year, Murray PHN aims to produce 2 in-depth reports on issues of importance to the health of our communities and our work. This time we've looked at the impact of ageing in our communities, including the importance of maintaining good health as we grow older. We also looked at how our healthcare systems can support older people in rural and regional settings. In our grandparents' generation, getting old began at 40, whereas today, people of 60 don't feel old in any way. With increased scientific knowledge and modern medicines, we now know we can stave off the traditional diseases of ageing with good diet, regular exercise, mental stimulation, social engagement, and personal health awareness. This means people's post-retirement years can be a time of new beginnings, travelling, learning new skills, maintaining fitness, volunteering, and perhaps spending time with family and friends. The subject of healthy ageing is both topical and important for all parts of our regional health system, from GPs, hospital emergency departments, aged care facilities and home care providers. The past 2 years of the COVID pandemic have shown us that people living in aged care are amongst the most vulnerable in our communities. The shortcomings of the aged care system are now the focus of significant conversations at the local, state and national level, with greater political will to make a difference to older Australians and the workforce that support them. With our ageing population, we need and deserve a better aged care system, particularly in our region, with a quarter of our population projected to be over the age of 65 by 2030. Issues such as homelessness, mental illness, or social or economic disadvantage can make it harder for people to achieve good health outcomes in older age. The Murray PHN region is home to a third of Victoria's First Nations peoples, and we know these communities can face even greater health challenges at an earlier age. There is still a gap in life expectancy of up to 9 years for First Nations peoples compared to non-Indigenous Australians. 4 preventable chronic conditions, cardiovascular disease, diabetes, cancer, mental illness, are direct contributors to that life expectancy gap and need to be addressed at the primary care level. COVID has had a disproportionate impact on the morbidity and mortality of older Australians, but also the social isolation has seen them separated from family, friends and regular activities. Those who lived in aged care were often locked down for their physical safety, but bore the brunt of the emotional and social damage that isolation has caused. Murray PHN is pleased to have played our part in helping aged care facilities get residents and staff vaccinated against COVID last year. We continue to work with aged care to provide allied health services to help people regain their confidence and social connections. We'll also ramp up our support to aged care facilities to help them increase their use of medical telehealth and after-hours services to keep residents safe and out of hospital. As one of 6 Victorian PHNs and 31 PHNs across Australia, our strategic priorities are set by government and expanded by our review of the needs of the population within our 100,000 square kilometre region. As a PHN servicing regional and rural Victoria, we have an important goal in increasing the sustainability of our system to support the primary health needs of our communities. We work to support and grow our local health workforce, and in doing so, improve the health outcomes of people in our region, including older people. The insights and statistics you'll read in the Murray Health Report, Ageing in Our Community, are drawn from the data and the analysis of the information we collect through our health needs assessment and the work with our partners in the region. This Murray Health Report will give readers an insight into the challenges that our health system, our communities and our families face as our populations grow older. We hope you find this snapshot on ageing both useful and informative. For earlier Murray Health Reports, please visit our website at murrayphn.org.au.